We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to shop for health plans in New York, we went to the New York Healthcare Exchange, New York State of Health. We selected View Plans Now to preview plans. We narrowed the search to zip code 12143, Albany County, and said we were looking for medical care coverage for an individual. That resulted in several choices covering 15 pages of different health plan options. We narrowed the search to silver plans and then had 38 plan choices from 8 different insurers. That's still a lot of choices for a consumer to consider, so we were glad to see that the website offers a handy tool that allows consumers to compare plans. We tried it out by picking 3 of the silver plans from different insurers and selected Compare. The results are helpful. The consumer can see quality ratings where available, monthly premiums, deductibles, and out-of-pocket maximums. Some of the language used isn't consumer friendly. For example, there is a difference in an aggregated deductible and an embedded deductible, one that can make an important difference for consumers, but there aren't any definitions handy. Otherwise, the tool was easy to use and provides helpful assistance to consumers. We went back to our list of silver plans to see how easy it is to find a list of covered doctors under the plans. We selected the silver plan with the least expensive premium to start our search. There isn't a link to search for providers up front, so we looked under View Details. Though it's not the most consumer-friendly way to describe doctor's visits, we looked under Outpatient Services to see if there was a link there. Though there is a lot of information, including consumer costs for different types of doctor visits, there isn't a link to search for covered providers. Through some trial and error, we found the link under the Plan Documents tab. The link took us to the insurer's website that has a search tool for covered providers. We had to select our physician type and the name of our health plan, Total Independence, to make sure we were looking at the right network. We found the search engine relatively easy to use once we found the link to it. Next, we tried the same search for a different insurer. We picked the insurer with the next least expensive silver plan premiums. Again, we needed to view details. There was not a link to covered providers under Outpatient Services, so we checked Plan Documents. There we found a link that took us to the insurer's website. We had to select our product, New York State of Health Marketplace, to start the search. We could search for various specialty providers by the type of specialty or the doctor's name. We found the search engine easy to use. Overall, finding the links to search for doctors covered by health plans took some effort, and we needed to be certain to select the correct name for our health plan to make sure we were searching the right network. Once located and the plan selected, the search engines worked well and were easy to use. Another question consumers want to answer is, are my medicines covered? We tried to find that information with the same 2 silver plans. For the first plan, we needed to look under Details, since there isn't a link up front to a list of covered medicines. There also isn't a link under the Prescription Drugs tab, although there is information about consumer out-of-pocket costs for medicines. After some looking around, we found this link under Plan Documents. The link directly opens a document. This file is labeled as the plan's drug formulary and includes clear instructions on the front page of how to search for medicines within the document. The document also provides a lot of detailed information up front to help consumers interpret and use the document. For example, it explains that the medicines are arranged into a 5-tier formulary, with each tier representing the out-of-pocket cost for the consumer. The information also describes various restrictions on access the plan uses, including prior authorization, age and quantity limits, and step therapy. It explains the appeals process for consumers as well. The actual list of medicines starts on page 19. This insurer uses technical medical terms to classify the medicines. For example, a consumer would need to know to look under anti-neoplastics for cancer medicines. And anti-hyperlipidemics are where a consumer needs to look to find cholesterol-lowering medicines. To see out-of-pocket costs, the consumer needs to revisit the exchange and look at the Prescription Drugs tab. For this plan, all but generic drugs are subject to a deductible, so the different tier levels aren't as important. We tried the same search for covered medicines for the Silver plan with the lowest premiums offered by a different insurer. Again, we had to view Details. The tab for prescription medicines explains the consumer's costs, but does not have a link to covered medicines. We found the link under Plan Document. The link directly opens a document. There is no introductory language explaining the document, what the different terms mean, or how to search the document for information. The document lists medicines organized by therapeutic classes, which are not consumer-friendly. For example, cholesterol-lowering medicines are listed under anti-hyperlipidemics and other technical subcategories. Cancer medicines are listed under anti-neoplastics. The document lists a tier number for each medicine, which is related to the consumer's out-of-pocket cost, though that's not explained in the document. The consumer has to go back to the exchange to see what those tier numbers mean in terms of out-of-pocket costs. Looking at that information, the summary of costs on the exchange doesn't use the tier numbers. That's confusing and can make it very difficult for a consumer to estimate what her costs will be for the medicines she needs. Given the large number of coverage options consumers have in Albany, the exchange provides a nice comparison feature that will help consumers make informed decisions. Finding links to lists of covered providers and covered medicines took some effort. Once located, the provider search tools the plans have were relatively easy to use. The ease of using the lists of covered medicines, though, varied by insurer. Both use technical medical terms that can present challenges for consumers checking to see if their medicines are covered.